let me also...
The chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, leads the day's briefing, noting the consistent rise in the number of confirmed cases in the country.
To thank you for...
He informs the gathering that the government will not hesitate to change its decisions, even as he urges citizens to key into a national prayer and fasting program against COVID-19.
One significant observation the PTF wishes to make is the new rise in cases are to be expected as nations start to ease restrictions. That is the picture all over the world. We shall, however, proceed with caution, and we shall not hesitate to change course when the need arises. The co-chairman of the Nigerian Interreligious Council, NIREC, would be directing Muslims and Christians to go for a period of fasting and prayers. And we urge all Nigerians to participate in this effort to seek for divine intervention in the calamity that is befalling all of humanity.
The Minister of Health also explains what the government is doing to reduce the number of COVID-19 related fatalities.
The Federal Ministry of Health's plan will therefore be to focus more on minimizing fatalities by prioritizing preemptive admission to hospital for medical observation. All persons who test positive for COVID-19 and meet our definition of vulnerability. These include the elderly, diabetics, asthmatics, and persons in treatment for chronic infections and conditions. Preliminary results of analysis of the so-called Madagascar herbs or organics done by the Nigeria Institute for Pharmaceutical Research and Development shows that it is the same plant called Artemisia annua, which is grown in nitrate farms in Abuja. Further research on its efficacy will be conducted when the grant for the research is approved.
There are over 30 molecular laboratories for testing COVID-19 in Nigeria. Yet the country has barely tested a little above 138,000 samples in 5 months.
There's clearly a lack of demand. A lot of these laboratories are underutilized. Their capacity far exceeds what they're getting in terms of samples.
Testing, isolation and treatment are both key components of the global response to COVID-19. This is where Nigeria needs to step up, as the 138,462 tests recorded so far is not good enough for a country of an estimated population of 200 million people.